Welcome everyone to today's webinar entitled Act on Time, a Parkinson Resource Toolbox. I'm Stan Mahabir of Discovery Campus, and I'm moderating today on behalf of Parkinson Canada. I would like to acknowledge that this webinar has been sponsored by AbbVie. Our expert speaker today is Nellie Gontier, the Education and Training Specialist for Parkinson Canada. She'll be taking us through the Act on Time initiative and discussing the now available tools and resources. Allow me to share a little about our speaker. Nellie Gontier is the Education and Training Specialist for Parkinson Canada. She is an articulate and dynamic speaker with many years of experience in the healthcare, academic, and corporate sectors. She has worked as a clinician, educator, practice management consultant, keynote speaker, and corporate manager. Since joining Parkinson Canada in August of 2017, she has been the lead author and developer of several educational resources, including the Act on Time program pieces, Parkinson Disease and Driving booklet, At Ease, a book on accessibility standards and neurological conditions, as well as the soon-to-be-published Care Partnering book. She continues to provide training to corporate clients and healthcare clinics, speaks at society meetings and conferences, and has written numerous online continuing education courses for healthcare providers. I want to remind everyone that today's session is being recorded for future viewing. You will be able to access the recording by visiting our website at www.parkinson.ca or by visiting our YouTube channel, The Knowledge Network. To ensure full compatibility and a glitch-free experience during this session, please ensure you are tuned in using Google Chrome or Firefox. To report any technical issues at any time during the webinar, please go to the menu at the right of your screen. To open and close this menu, click on the red tab. Use the To Admin and Ask a Question buttons to type in and submit your request. We ask that all other questions be reserved for the end of the presentation, at which time our speaker will answer them. Please ask any questions that are of a general nature, not solicitous of medical advice. We will make every effort to answer all questions. And with that, please join me in welcoming our guest, Nellie Gontier.
Hi, Stan. Thank you for that introduction. I just want to welcome everyone to this webinar. We've been working on this project for a very long time, and we are extremely excited to be launching it today officially. So sit back, relax, enjoy the webinar, and, ask us questions at the end, because that's what we're here for. And from this point forward, we'll proceed with the content. My name is Nellie Gontier, and I'm the Education and Training Specialist for Parkinson Canada. Before we proceed, I want to take a moment to thank my team, Education and Client Services, for contributing to and supporting this endeavor at every step of the process. I also want to recognize the contributions of other departments, including the Parkinson Canada Communications team, who provided support with language, editing, and design. As well, the community development coordinators from across the country who gave us their feedback on the prototypes originally created to ensure that the tools in the final kit met the needs of all Canadians with Parkinson's, regardless of where they live and what their specific needs. And I also want to thank the healthcare providers and persons with Parkinson's who reviewed the tools in our toolbox and provided their generous feedback. For those who are new to Parkinson Canada, I'd like to take a minute to tell you a little about what we do. It's our aim to raise hope, awareness, and quality of life for persons with Parkinson's. Every year, Parkinson Canada reviews research proposals from all over Canada and funds innovative research leading to better treatments and improved quality of life for people with Parkinson's. We are also heavily involved in the Parkinson's community at federal and provincial levels, advocating on important issues including genetic fairness, access to therapies, care partner support, income security, and brain health. Our information and referral associates provide information and answers to questions via telephone, email, and in-person visits. They send out customized information packages to individuals with Parkinson's and their families. Our support initiatives include community outreach through our network of community development coordinators who help establish support groups and coordinate in-services and presentations for healthcare providers. And our education team produces materials and informational resources, including this toolbox, for anybody who needs them. As we begin, I want to say thank you for joining us today. We're all here to familiarize ourselves with the Act on Time campaign and its individual components. So by now you're probably wondering, what is this kit all about? Well, it's not really a kit, but a compilation of tools and resources that, when combined, form a toolkit designed to address the needs of persons with Parkinson's and to support their care and optimize health outcomes. Each kit, if you will, is different based on who's going to use it. For example, a healthcare provider would only need some of the tools and resources, while a person with Parkinson's and their care partner would need others. So what is Act on Time? Act on Time is an acronym that stands for Alerts, Care, and Treatment on Time. To us and to our clients, it means that meds or medications are provided on time, every time. Accidents are prevented. Setbacks are avoided. Communication is supported. And quality of life is improved by utilizing the right tools to manage symptoms, navigate care, and improve overall health outcomes. Parkinson Canada has always been dedicated to providing the Canadian Parkinson's community with the tools and resources to help improve the lives of those living with Parkinson's disease. You may recall that a while ago we adopted the Get It On Time campaign tools from Parkinson United Kingdom. This campaign was aimed at making sure that persons with Parkinson's got their medications on time, every time. This campaign met the needs of Canadians with Parkinson's for several years. However, it became clear to us that there were other needs that were not being met by this one resource. So we went back to the drawing table. A needs assessment was performed in consultation with specialists in the field. Parkinson Canada also reviewed and evaluated existing tools and resources from around the world. In doing so, several more gaps were identified that we felt we just had to fill. So let me ask you something. What does Parkinson's look like? Ask yourselves, what do you believe are some needs that are not being fulfilled? Take a moment and think about this. After much consideration, I'm sure that we would agree that each person with Parkinson's experiences it differently. No two people with Parkinson's will have the same lived experience. Although there are some commonalities, each person with Parkinson's has a unique set of symptoms, both motor and non-motor, with varying degrees of severity. As a result, they have to be given individualized medication regimes that meet their specific needs. And, to complicate matters even more, each person living with Parkinson's responds differently to the medications, to the doses, and to the timing. Often they will have on and off periods throughout the day, with wearing off periods that vary from person to person. And differing disease progression patterns affected by lifestyle and other factors such as genetics create challenges for the care partner and for the healthcare providers that treat them. When a disease presents with such variability from person to person and with such a wide range of symptoms, affected bodily functions and abilities, inevitably there would be challenges in trying to meet the needs of the individual while addressing the needs of the community as a whole. So many challenges. So you can see how we faced many a challenge in producing something that met all those needs, while anticipating that those needs will also change with disease stage and progression. Yet, however daunting the task appeared, we were highly motivated to produce something that really served our community. And that community consists of persons with Parkinson's, caregivers or care partners, and healthcare providers. I'm sure you can appreciate that the components of the kit therefore needed to be numerous and varied. There are pieces that are specifically designed to support and help people with Parkinson's, others that can be utilized by caregivers and care partners to make the daily care of their loved ones more effective and efficient, and still others that are designed to alert, to improve communications, and to increase the overall knowledge of Parkinson's for healthcare providers. From inception to creation, it was designed to do a number of things. Fill the gaps, improve health outcomes, improve and maintain quality of life for people with Parkinson's as long as possible, provide care partners with the tools to more easily and effectively assist their loved ones, and create alerts to improve the care and treatment received from healthcare providers. It is essentially designed to empower everyone involved, people with Parkinson's so they can get the best treatments possible and provided with as much autonomy as possible for as long as they can so their quality of life is optimized. Care partners so they can better support their loved ones and so that a minimal effort on their part elicits the maximum benefit to the person with Parkinson's. And healthcare providers so they can better understand the needs of Parkinson's patients and avoid any action or treatment that might cause them harm, while ultimately facilitating their work with Parkinson's patients, whether they see them in the office, in the emergency room, the hospital ward, the operating room, or long-term care facility. I'd like to share something from a support group member in Quebec who once told a nurse, and I'm quoting her here, "If you help me with my meds, I'll be able to help you with my movements." Now, fortunately for her, she was capable and comfortable enough to bring attention to her needs. But how often is it that we see the opposite happening, especially for those in the later stages of the disease who may be living in a long-term care facility? If a person with Parkinson doesn't get their medications on time, they may experience setbacks that can take days and even weeks to recover from. These setbacks can contribute to further problems with any comorbidities or other conditions that they may have. So it's no surprise that we stress again and again that people with Parkinson's need to receive their medications on time, every time. They also need information that will help them and others manage the disease and its symptoms more effectively to avoid setbacks and improve the quality of their lives. It's also important to recognize that they need to maintain detailed records so they can receive the individualized treatments they need, and so information can be shared with the various members of their multidisciplinary or interdisciplinary healthcare team. So take a minute. From your experience, what do you believe are some of the other needs that people with Parkinson's have? As we mentioned, we also wanted to support care partners because they need as much, if not more, support in order to be fully able to help their loved ones. In the words of a caregiver, caregiving can mean many things to different people, and this one caregiver wanted to tell you, and I'm quoting, "I need you to understand what caregiving means." And that experience also varies from one person to another. Unless we are caregivers or care partners, how can we fully appreciate the experience of caring for someone with Parkinson's or another chronic illness? I want to share some quotes from a website called the Caregiver Space, a blog where caregivers open up about their experience of caregiving. Let's take the first one, for example. Here, Janine says, "It sucks. It's draining. It's tiring. It's hard. It's painful. It's lonely. It takes someone special to do it. It's what we do. We never stop." And we also have Phil who says, "Caregiving is rewarding and it can suck at the same time. All you can do is be there or make sure others are when you can't be generous of heart, and that's about it, I guess." Or Elizabeth says, "You lose your loved one, you lose yourself, you lose your family and friends, and you're unable to help your children and grandchildren." Or as Greta puts it, "It's exhausting, it's guilt-ridden, it's unforgiving." As you can see, there are common areas and common experiences, and yet some differ. You can see how important it is for us to help bring hope and help to care partners with this kit and with the pieces, so we can lighten their caregiver burden along their journey with their loved one. In a way, we aim to create a care package for care partners. And what about care partners or caregivers? What are their needs? What do you think the needs are that are still left unfulfilled? Healthcare providers also need these tools and resources. They too need information and support. Not all healthcare providers are familiar with the particular needs of those living with Parkinson's, and because there are so many different types of healthcare providers, they too have varying needs. All types of healthcare providers will benefit from this kit, including the ones you see here. Healthcare providers need to have an awareness of the needs of persons with Parkinson's. They also need to be alerted to certain risks so they can take actions to avoid problems and setbacks while providing individualized care to their patients with Parkinson's. They need to have Parkinson's-related information and resources at hand when they need to refer to it, or if they need to provide it to a patient with Parkinson's and their family members. And they need to understand the most common Parkinson's treatments, including the medications typically prescribed. Some of the side effects of those medications, the surgical interventions that may be used, and what they must do to ensure that any patient they see who may have Parkinson's is treated accordingly and no adverse effects or conditions are created. So what about healthcare providers? This group is vast and varied. What do you believe are some of the needs of these healthcare providers? I want to mention here that as we developed this kit, we often referred to the Canadian Guidelines on Parkinson's disease for guidance. You can find the guidelines on our website and at the URL on this slide if you wish to review them for more information. It's important to note that as we speak, they're being revised and we hope to have a new version of the guidelines sometime soon. The Canadian Guidelines on Parkinson's are aimed at enhancing care for Canadians with Parkinson's, improving the standards of care and access, and guiding healthcare providers to best manage Parkinson's disease. So we aligned our Act on Time kit pieces with the goals of the guidelines, and we kept our eyes on the target with each piece. So I've kept you waiting long enough, and you're probably wondering why now, what's in the kit? Well, one word. Lots. It contains the tools and resources needed by people with Parkinson's, as I said, their care partners, and the healthcare providers, so everyone can better manage the disease symptoms and challenges that they face. And we're hoping with it, it'll help improve communications and overall health outcomes, leading to a higher quality of life for people with Parkinson's. It contains alert items and information, guidance on care and mitigating risks, treatment information and best practices, communication tools, informational sheets, and even a booklet, and other very useful things. And I want to mention here that although there are a lot of pieces and components in the kit, not all kits will be exactly the same. Depending on who you are, whether you're a person with Parkinson's, a care partner, or a healthcare provider, the contents of your kit will be slightly different because each group has different needs. So let's take a look at each of the pieces in more detail. To start, every kit will include an introduction letter. And I think this is a great place to start our expedition into the kit. The letter briefly explains the kit and also lists each of the pieces along with a brief description of them. You've probably by now noticed that the tools are grouped in a specific way. Each gray box has an icon at the top right-hand corner, which indicates the purpose of the tools in that particular box. For example, the first box contains items that provide updated information, while the second box contains alerts, and so on. If you have the pieces in hand, take a minute and review the letter and familiarize yourself with the various names and uses of each piece. Now let's take a closer look at each of those pieces. First is the My Parkinson's Disease Summary and how to get the most out of your neurologist visit. This is a double-sided assessment tool on which you can capture valuable and relevant information to take with you each time you visit your neurologist. It can be completed by either the person with Parkinson's or their care partner. This piece predated the creation of the kit but has been updated to improve the content and the accessibility. The My Parkinson's Disease Summary is a checklist of symptoms that the person may be experiencing. Symptoms had been grouped in a logical manner, and with the addition of some symptoms and scales, the information captured actually paints a much clearer picture of the experience of the person's symptoms at any given moment in time. On the opposite side, the How to Get the Most Out of Your Neurologist Visit is a tip sheet on how to improve communications with your doctor and how to maximize the short time you get with him or her. As you all may know, time with any specialist you may see is very limited. So this tip sheet helps people with Parkinson's and their care partners better manage that relationship and make each visit, which can be months apart, more effective at meeting the needs of the patient and improving overall communications. Also included in the campaign in the kit is the Parkinson's Disease Medical Alert Card. It's a wallet-sized card that gets filled in with pertinent information that may be needed in an emergency situation. It includes contact information for the person with Parkinson's, an emergency contact, and relevant medication and dosing information. It ought to be completed and then stored safely in a wallet or purse so it can be retrieved when needed. If any of the information changes, you simply get another card, complete it with the new information, and store it again. It's handy, and it provides relevant information in a time of need, especially if the person with Parkinson's can't communicate this information to EMS, to police, healthcare providers, or other first responders. Parkinson's disease stickers and magnet. These are to be used to alert healthcare staff of Parkinson's. They can be used in hospital or long-term care settings, and even with other healthcare providers, so the patient's condition is identified early and not missed. Stickers are intended for placement on medical charts and records, while the magnet can be placed on the end of the bed or other magnet surface, so that staff who may not be looking at a medical record know immediately that a patient or resident has Parkinson's disease. The hospital notification is a very important tool, and this goes along with the alert magnet. This sign is designed to be posted by the hospital or long-term care bed of a person with Parkinson's. It can even be placed on the whiteboard next to the bed, which many hospitals are now using to note important information. The sign alerts any healthcare provider to the specific needs of the patient, and it also advises them of what to look for, what to do, and what not to do with any patient who has Parkinson's. Medication Alerts Tear-Off Pad. Now, this is a pad of sheets that can be torn off. In other words, a person with Parkinson's or the care provider can carry this with them, and each sheet contains information on medications that should not be prescribed to someone with Parkinson's if they're taking certain PD medications. Not only does it list the medications to avoid, but it also has recommendations for substitutions. This pad can be taken along when visiting hospital emergency rooms and given to the necessary healthcare providers. Parkinson's Disease Informational Poster. Information relevant to healthcare providers wasn't captured in one concise resource in our repertoire of materials, so we created a poster on Parkinson's that's intended for use in healthcare settings. It's designed to bring attention to the disease, some of the alerts related to it, and to inform staff in medical offices, clinics, and hospitals of the needs of persons with Parkinson's, the symptoms associated with the disease, the medications typically used to treat the symptoms, and the contraindicated medications. It also includes recommended alternatives that may be prescribed. It's our hope that this poster will become the flagship of Parkinson Canada in many healthcare settings, including long-term care facilities. Now, this particular tool, the My Parkinson's Disease Navigator, is really an extraordinary tool. Information and communication are essential parts of giving and receiving proper care. A person with Parkinson's cannot receive the care they need if they do not share relevant experiences and symptoms with the necessary healthcare providers. They'll also benefit from having good records of their symptoms, treatments, healthcare provider recommendations, suggestions, and information provided. And healthcare providers cannot provide effective, individualized care and treatments if they don't ask the right questions, share information with the appropriate stakeholders, or learn as much as they can about Parkinson's. The tool we created for this purpose is this navigator, a tool in which a person with Parkinson's, as well as the healthcare providers, can record, track, and share information, recommendations, and instructions that will help improve the management of the disease symptoms to further improve the quality of life. It's designed to be used as a go-between for healthcare providers who would normally not necessarily share reports each time they see a client or patient with Parkinson's. For example, a physiotherapist doesn't necessarily send reports to the primary care practitioner or family doctor to update them on their mutual client's progress. It's often assumed that the client or patient will report any progress to the primary care practitioner if and when they're asked. This presents obvious challenges. Moreover, if an occupational therapist, for instance, in the course of working with a patient with Parkinson's, notices some signs of another condition or new or concerning symptom that may be related to Parkinson's or the medications used to treat it, she or he can write a note in the navigator with their observations, and this can be taken back with the patient and shared with their other physician. Another use for the navigator is as a communication tool with the caregiver or care partner. Let me share an example with you. I have two elderly parents who have some health issues who see a variety of healthcare providers to manage those issues. Although I've encouraged it, they do not record any of the information, instructions, or recommendations they're given by each of their doctors and the other healthcare providers. Instead, they attempt to rely on memory. Each time this happens, and I ask them about it, about their tests, their diagnostic results, or ask if there have been any changes or additions or recommendations, I'm left with many questions and few, if any, answers. I'm left feeling ineffectual and unable to support them or their decision-making. My only remaining option, if I'm to be effectual as a care provider or care partner, is to go with them to each appointment and find out the information for myself. This isn't always possible, especially if one is juggling work, children, and other responsibilities. And my situation is not unique. This is very common today with many care partners and caregivers who find they need more information in order to help their loved ones. Using the navigator as a record and communication tool will help everyone become more effectual in their provision of care and treatment of the person with Parkinson's. Here's another page of the navigator. And as you can see here, it can include the date, any clinical notes, any provisions that need to be made, any recommendations, and any instructions. This allows better communications between the patient, the care partner, and the healthcare providers who treat. And this is the booklet that we mentioned earlier, Managing My Parkinson's Disease in Healthcare Settings. This book provides extensive information on what a person with Parkinson's ought to know before visiting any healthcare setting, including hospitals. It provides tips on how to better manage the disease in each type of setting and under varying conditions. It also includes information on what to expect, what to ask, what to do, what to bring, and how to follow up after contacts with specific healthcare providers or stays in hospital. The information within is designed to facilitate these processes and to improve communications with healthcare providers so problems can be prevented and proper care provided. It also contains a chapter on advocating for oneself or advocating for your care recipient to support more effective and timely communications and treatments. Some of you may already be familiar with this booklet, Medications to Treat Parkinson's Disease, which contains up-to-date information on all the medications prescribed for Parkinson's, along with common dosages and side effects. Healthcare providers and pharmacists who see patients with Parkinson's, and even those who yet do not, would benefit a great deal from this resource. Very quickly, you will see it will become the go-to reference for Parkinson's medications. Persons with Parkinson's and their caregivers, care partners, if they feel inclined, may also benefit from the information contained in the booklet, as it sets out the known causes for certain symptoms that result from specific medications. It explains what could happen and provides options on how to deal with it. We've included in this, and this is strictly for healthcare providers, we call it the Parkinson Canada Professional Referral Pad. This simple tool has been in use for some time now, but it now has the Act on Time logo and branding. It can be used by any healthcare provider as a referral sheet directing persons with Parkinson's and their care partners to Parkinson Canada, where they can benefit from the resources and client services that we provide. And I love this little ingenious container. It's the Parkinson Canada convertible pill case. It holds your Parkinson's medications, and it also converts into a cup in which to hold water you'll need to take your pills. The clever design and compact size is ideal for putting in your pocket or purse for those times when you just need a dose or two to take with you. With this tool, you can take your medications almost anytime and anywhere. Where can you get the tools in this toolkit? You can reach out to Parkinson Canada at 1-800-565-3000, or you can email us at education@parkinson.ca. And please feel free to visit our website at www.parkinson.ca and go to the resources section where you'll find the Act on Time pieces. Each will be available to you to download and print off, or you can order them through us.
Thank you, Nellie, for a very informative session. As we begin the question and answer portion of our session, we want to remind you that we value your feedback. We'll be sending a follow-up email that contains a survey link, and we'd like you to take a few minutes to provide us with your feedback. We will now open the forum for questions. And I see there's a few questions here coming in. I'll just start with the first at the top of the list here. So the first question was from Louis-Marie Gagnon, and that person asks, is this kit in English only, or does French also exist?
So all of the pieces that we've showcased today are available in both official languages.
Okay. I've got another question here from Marie Thun. What is the estimated rollout time in particular with LTC?
Rollout, does she want to define rollout?
Sure, I'll just wait till she responds to that, and we'll come back to that question in a moment.
Yeah. So I'm just going to maybe try and guess at what she means by rollout. Maureen, if you mean availability to long-term care facilities, that would be immediately. So the pieces that would be appropriate for long-term care facility would include the magnet, the stickers, the informational poster, possibly the hospital notification alert sign as well. There may be others. We'd have to look at what your long-term care facility needs in particular.
Okay, if she responds to that, we'll follow up with it. Anna has a question here, as well as a few other people. Is there a cost to the kit?
There isn't. So I have to, let me back up a little bit and make it very clear. We at Parkinson Canada cannot do what we are doing and creating this campaign and all of the pieces, generating them in hard copy format without the generous donations of our community and our donors. So please continue to support us, because this is where your money is going. This campaign was produced in-house. It was not farmed out to a third party, so we kept costs down that way. But we do incur the cost of the printing, the design, just the distribution. So shipping ends up costing quite a bit. So there is no cost to the pieces. And we at Parkinson Canada incur the cost of the shipping. But again, I just want to stress it's so important that donors donate to help us continue to do this.
Okay, we've got quite a few questions rolling in now. Let's start off at the top of this list. Linda Redford asks, are you sending it to LTC or do they have to request it?
So that would be up to the community development coordinators, who are the feet on the ground for Parkinson Canada. If they identify the need in their community with specific long-term care facilities, then it's up to them or the facility to reach out, and we can provide them with what they need.
In line with that question, Palmiere has a question. Do you have a PowerPoint that we can use to make presentations to LTC and other healthcare professionals?
Absolutely. Absolutely, we do. And they are ready, and we will be rolling those out soon. So if there are any support group facilitators, and of course our community development coordinators, our CDCs, will be on the ground and will be utilizing these presentations to educate everyone.
Monique asks, how important is it for a patient to continue to see a specialist? My mother has Parkinson's, and one time when I mentioned her to a GP changes I had noticed and whether she would go to see the specialist again, he said it was not necessary to see the specialist and he adjusted the medication himself. That concerned me somewhat.
Well, that is a medical question. And of course, although I'm a healthcare provider, I am not a specialist. I'm not a neurologist or anything like that. But I do believe that it is important to see and be seen by a very well-connected interdisciplinary team of healthcare providers. For a list of what that might look like, if when you do order the pieces, take a look at the front of, or the section at the beginning of the Managing My Parkinson's Disease in Healthcare Settings, or the beginning section labeled My Team at the front of the My Parkinson's Disease Navigator tool, and it'll explain why it is critical for people with Parkinson's to see multiple specialties as part of their healthcare team. I hope that's answered the question.
All right, Catherine asks, does the kit limit itself to guiding the Parkinson's community as it manages medication only as a treatment, or does it also provide information about activities that are recommended?
All of the above. So it isn't just limited to medications or getting medications on time, although that is a large part of the messaging of several of the tools. But having said that, I think it's important to identify and stress again that when we did our needs analysis, we recognized that there was more than just the one need. And so communication was identified as a need. Healthcare professionals amongst themselves do not communicate very well. And it often falls upon the person who is the patient to relay messages between them. And that becomes a challenge as the disease progresses. And of course, I mean, we have a lot of things going on in our lives, and to remember all of the jargon, the details, the terminology, and the instructions that one healthcare provider may give us and relay it to another, that can be quite the challenge for anyone. So it's important that, it was important for us to develop a tool that helped that type of communication, and that is My Parkinson's Disease Navigator.
Penny asks, can the hospital summary be used in hospitals whose charts are all computerized?
Very good question. Paperless charts, that's a big thing these days. However, even with paperless charts, there are still pieces of paper. And so it's important that if someone, for example, goes into the emergency department for something unrelated perhaps to Parkinson's, a fall, or the flu or pneumonia or something else, as soon as you can, provide those pieces of paper or those stickers to the healthcare provider that you are seeing in the emerge. There's also the pad of medication alerts that can be provided. So there are multiple ways to communicate the alerts and the things to avoid and the suggested treatment options that can be used. So I do want to say one thing about paperless systems. All of them have a medication or medical alert option in them. I know because we use one at the office, and they do have that. It's important to relay that information to the healthcare provider and request that they put a medical alert on the system.
Alrighty. Just scrolling through a few more questions that have come in. Mm-hmm. Is there any information in the kit about nutrition for persons with Parkinson's?
So that's a bigger scope of things. We have other resources that Parkinson Canada offers that can address nutrition, as well as other things like Parkinson's disease and exercise and various, we have all kinds of resources. So we didn't really want to make nutrition specifically a focus of this kit because alerts, care, and treatment had to be narrowed down. Otherwise, I don't want to use the kit, but the resources would be extensive. We already now, as part of this initiative, have approximately a dozen resources. So, if we expanded upon that, it would almost become too large. So we've tried to focus it to make it most effective.
Alrighty. Maureen says, thank you, Nellie, for a great presentation.
Thanks, Maureen.
As someone who was involved with previous GOT programs, I love the new format. Any thoughts on traveling for persons with Parkinson's? Would someone take the bag, for instance, with necessary papers?
You got it. Yes, absolutely. In fact, one of the things that we recommend is that you keep all of the pieces in a bag, whether it is the Parkinson Canada bag that was highlighted here in the presentation, or it's a personal overnight bag that you have at home. You can always order the tag, the Act on Time tag, and you can attach it to any bag. But yes, we recommend strongly that you keep those things in there, have them ready, because you never know when you might need them, and emergencies do happen.
We've got one more question here from Gloria. Mm-hmm. Are there plans in the future to have the kit in other languages, such as Chinese?
That's a really good question, Gloria, and we've actually pondered that question for many of our resources, and it all comes down to, I hate to say this, but it comes down to funding. And we can only fund what we can with the resources, i.e. the funding that we receive. And that's one of the reasons, and I don't want to sound like I'm plugging donating at this time, but we really want to make it clear that it is our donors that make these things possible, that we couldn't have even created this entire campaign and all of the pieces if we didn't receive those donations. So yes, if we had the resources and the funding, we definitely would look at other options, because we recognize that we do live in a multicultural society and we do have a very large Chinese population, among others.
All right, thanks for that. We've got another question from Penny. Could you explain a bit more about the navigator? Is it something that is computerized?
It's not computerized at this time. However, you can download all of these resources off of our website. If they may already be uploaded onto our site. If they're not, please reach out and let us know if anything is missing. But you will either right away or in the very near future be able to download each and every one of them. Is it computerized? We are going to be converting some of the files into what's known as a fillable PDF, so that when you do download it, you can actually enter all of the information on, like literally click onto that field and type it in, and then you can save it that way.
All right, we've got a question from Zoe.
Mhm.
Is the kit useful for people in early stages of the disease? Are there other kits or resources to get us started?
I'm going to stress that the earlier you receive these resources, the better. In fact, if you are newly diagnosed, this is the ideal time to be ordering the resources, in particular, the Managing My Parkinson's Disease in Healthcare Settings. This book really is a phenomenal resource that talks you through what will happen when you see different types of specialties, or when you go into different types of healthcare settings, whether it's seeing your neurologist or your primary care physician or a long-term care facility or a hospital emergency department or an admission to hospital for any reason. It will provide you with information on what to expect, what you can ask, what you should bring with you, what you should do afterwards. So I strongly recommend, if you are newly diagnosed, to order this booklet.
All right, we've got one question here from Lynn, and I'm just going to paraphrase a little bit of it here. So Lynn is expressing that it's very challenging to get everybody involved and on board, and her experience with Get It On Time has been that some of the healthcare folks don't always follow through, and she has to nag. She's going to try with this kit, but I think the substance of her question is there anything going on the healthcare side to inform the healthcare people that of participating in this kit?
So we are hoping that some of the participants today are healthcare providers. However, above and beyond that, every conference that we attend, including the Family Medicine Forum, which took place last November, we were already bringing awareness to these pieces and to this campaign. We are having several conferences in the near future where we will highlight this campaign again. And we are going to have our CDCs doing their utmost to reach healthcare providers. And we now have pieces that are specifically designed for them, like the informational poster, which is an easy target because every healthcare setting should have a poster with information on what to look for Parkinson's. And this particular one that we've designed not only identifies the 4 motor symptoms, it highlights the fact that there are all these other non-motor symptoms that they should be aware of. It also talks them through the alerts for medications. And it also brings attention to the fact that dosing is important, and important in terms of not just the timing, but also what's taken with it, i.e. protein, that type of thing. So yes, we have all sorts of plans, and we've already implemented many of them.
Okay, that's all the questions we have for now. If anybody else has any additional questions, feel free to type them in. We've got a couple of minutes left here. So we'll just wait for that. Nellie, if you've got any other remarks in the meantime.
Yeah, I just, this was truly a labor of love, and our team, because it was a team effort. Our team really dove down deeply into finding out what the needs are. And we recognize that needs will change, and we recognize that we may have missed a need or two here and there. That's inevitable. But this is these pieces and these resources will evolve, and they will grow, and they will change. So if you identify something, if you identify a need, or if you look at a piece that we've created and you say, you know what, when you go to reprint, you might want to add this. Please bring those things to our attention, because we rely on you and your feedback in order to give you the tools and the resources that you need, and to make sure that they are actually effective in meeting your needs.
All right, we did have 3 more questions pop in. Linda is asking, when will the Caregiver Guide be available?
Oh, so we're calling it the Care Partnering Book, and it will be available next month, late next month.
All right, and Monique is asking, are the kits going automatically to long-term care homes, or do they have to order them specifically? Namely, should I get my kit for my mom and bring it to the long-term care home myself?
Well, so the whole thing is a kit/toolbox, but like anything, you're not for every job, you're not going to use every single tool. So that's why I want to stress here that these are customizable. What I would suggest is talk to the long-term care facility, find out what they're missing, and we can help you with that in terms of suggesting pieces. So right off the top of my head, I would suggest the stickers. I would suggest the magnets, the hospital notification or alert sign, and I would suggest the informational posters right off the bat. But beyond that, if there's anything else that they feel they need, please bring that back to us and we'll do our best to supply them.
All right, Ian is just asking, is the Navigator online yet?
It should be downloadable online, yes. And if it isn't, please email us and let us know, because then we can make sure that it gets uploaded.
Alfred has a question here. What is the relationship between Parkinson.ca and the Michael J. Fox Foundation?
I don't know that there's a direct relationship between the two organizations. Our mandate is a little bit different. Michael J. Fox's mandate is mostly research and funding of research. However, we're all in this boat together in the sense that we are all aiming to find a cure for Parkinson's, and until that time, we'll do everything we can to support people with Parkinson's, their care partners, their families, and the healthcare providers who treat them.
All right, and Penny's got a couple of questions here. Is the webinar archived, and are support group facilitators going to make presentations about this?
So if you belong to a support group, I would direct part of that question to your facilitators. And the answer to the first part of the question is yes, this webinar will be archived, including the question and answer portion of it. And it'll go on our YouTube channel, The Knowledge Network. If you're registered for this webinar, you'll automatically receive an email following the closure of this webinar. Probably in the next couple of days or by next week, you'll receive an email with the link to the recorded or archived version.
Thanks, everyone. That concludes our webinar today. On behalf of Parkinson Canada, I want to thank Nellie Gontier and our event sponsor, AbbVie, as well as everyone online for participating in today's webinar and for supporting us in bringing you the conversations that you want and need. As just a reminder, please complete your online survey once it is emailed to you so that we can develop the programming that you want. For more information on Act on Time or to access a recording of this webinar, please visit our website at www.parkinson.ca. If you have any further questions regarding today's session, feel free to contact us by email at info@parkinson.ca or call us toll-free at 1-800-565-3000. As we sign off, Parkinson Canada would like to wish you all a wonderful day. Thank you.